Hello everyone, my name is Nchelem Ichegbo, and I'll be doing a presentation for an implementation research that was conducted in Kaduna State, Nigeria, and I'll be sharing my slides quickly with you. So the title of this abstract is Implementation Research on Strengthening Primary Healthcare Facility Managers on Routine Health Information System Responsibilities in Kaduna State, Nigeria. Primary healthcare facilities across the country cater to the needs of the population and can serve as an important source of routine surveillance data on the population. And as such, primary healthcare centers can serve as an early warning mechanism for emerging disease outbreaks. But unfortunately, many of these facilities do not report routine data into the MIS of the country. Now, the goal of the HMIS, which is to trigger urgent response mechanisms on emerging disease outbreaks, cannot be achieved if data is not reported routinely. And again, the outbreak of COVID-19 and its devastating impact globally has brought the need to address these early warning mechanisms effectively. The aim of the study was to identify challenges and enablers of implementing PHC capacity strengthening, and we did this by an in-depth understanding of stakeholders' experiences on implementation processes, barriers, and facilitators to implementation. And we had 4 research questions for this. Now, for the first research question, we asked, what is the reporting rate of the PHCs into the National Health Management Information System? What are the challenges faced with HMIS reporting compliance? What interventions are being implemented to improve compliance of PHCs to increase reporting into the HIS? And again, what are the interventions impacting the reporting behavior of the health facilities? For our methodology, study design was a mixed methods investigation to evaluate the project. We conducted key informant interviews, focus group discussions, and we also did a quantitative survey. We also adopted both retrospective and prospective data collection. For our first research question, we noticed a 93% completeness of data into the HMIS. Now, during the course of this study, the PHC managers had some training sessions on data reporting, data completeness, data quality, really. And we observed their data reporting rates prior to the capacity building sessions and after the capacity building sessions to see if there will be a change in data reporting. And prior to the capacity building sessions, we had about 83% reporting rates. And after the capacity building sessions, we had an increase in reporting rates, which is 93%. Reporting as it's been shown here on the slide. Our second research question on challenges faced with HMIS reporting compliance, we conducted key informant interviews among healthcare workers to discuss the challenges they face with reporting compliance. And from our findings, we had behavioral issues, that is to say, healthcare workers not wanting to do their jobs. Some facilities didn't have enough human capacity for reporting, and some other facilities, for some healthcare workers, we had issues of lack of training and lack of understanding of the reporting tools. And again, we also had field activities in the sense that healthcare workers, when they leave their facility to attend trainings for other programs in other locations, it reduces the human resource available in that health facility for reporting. These are some quotes that we got from some of the KIIs that were conducted. From one of the LGM and E officers, he said, the private health facilities are not complying, but then after the training, they hope that they will understand the importance of data reporting and they will comply going forward. The second quote here is from an implementing partner, speaking about sustainability and wondering how we would continue to sustain the interventions if these capacity building sessions stop. For our third research question that talks about the interventions being implemented to improve compliance of PHCs to increase reporting into the RHIS. For this, we conducted key informant interviews and FGDs, and these were themes that emanated from the transcripts. Continuous monitoring of facility data dashboard. So each facility has a dashboard where they monitor their reporting rates, and this sort of makes them understand that, okay, so they are not reporting optimally and they need to increase their reporting rates. The second one is addressing behavioral issues in the facilities. Now, for health facility workers that do not come to work on time or report on time or miss deadlines for reporting, the issues of behaviors are being addressed in the facilities. Nonchalant health facility workers are being punished or suspended or undergo another sort of training to address the behavioral issues. The third one there is continuous step-down training of facility staff. So if members of a health facility have been trained for data reporting, when they go back to their local facilities, they teach other healthcare workers present there on the data reporting skills that they have learned, data quality skills that they have learned. And the third one there is assessment of storage facilities. Now, they do routine assessment of storage facilities so that when the registers for reporting health data are getting exhausted or when they're getting finished, they get them replaced as soon as possible. Now, this is one of the ways of also improving reporting compliance to ensure that they have enough registers to keep collecting data and reporting data as they come. For our last research question, which is how are the interventions impacting the reporting behavior of health facilities? We also did key informant interviews and focus group discussions for this. And these are some of the themes that emanated from our conversations. Now, the healthcare workers themselves said, as a result of the intervention, the capacity building sessions, they are able to conduct data analysis and visualizations in the healthcare facility. This was said by the officers in charge of the health facilities. Set down training of facility staff by trained mentors. When some health workers are trained, when they go back to their facilities, they also teach other healthcare workers there what they have learned on data reporting. Defaulting healthcare workers will be penalized. The officers in charge of the OICs have been thought to penalize healthcare workers that do not report routine data as they are coming, that do not report data before the deadlines. And the last one there says, improve reporting rates of facilities across the states. Healthcare workers across the facilities after the interventions improved their reporting rates across the facilities. So we can see that there was a positive effect of the capacity building sessions and reporting rates of the healthcare managers for this study. This is the end of the presentation. Thank you.